Given your experiences and perceptions of the future of the healthcare market, what advice, career advice, do you have for students as they position themselves to be successful going forward? And let's first talk about your own path, if you don't mind.
Sure.
Tell us the story.
Sure. So I majored in physics at Mid. Took physics because I was somewhat interested in being pre-med as what I thought I was going to be an English major, but really fell in love with it and just decided to forget about being pre-med, and I just loved physics. And so that's what I focused on while I was there. When I left Mid, I actually went to work as a physicist at the National Security Agency, doing signals analyst type work. And at Langley at the CIA. And that had been sort of a bucket list dream of mine to work, either at the FBI or in national intelligence. And it was a really, impactful, mission-driven job to have straight out of college. I left there to go to venture capital to invest in the kinds of satellite and mobile communications technologies I had worked on, and really missed the purpose aspect of it in venture capital. It just wasn't fulfilling for me to sort of do the, pro forma analysis and play the role of investor. It wasn't what got me out of bed in the morning, and discovered that I was really a scientist at heart. So I went back to school to do the joint MD PhD program at Emory. And I think in retrospect, did the joint program because I wasn't sure. I wanted sort of a foot in both worlds of, do I want to be a clinician? Do I want to be a scientist? Do I want to try to, live the academic dream of seeing patients and running a lab? Worked on gene therapy for my PhD work, wanted to do something very translational. And so that work is now in clinical human trials, which is exciting. But that really, I think, a PhD for folks who are interested in being an entrepreneur, there's actually a lot of similarity in, graduate level scientific work of sort of the hypothesis and testing that hypothesis and building evidence and having to change course when things don't work out the way you thought they were going to work out. That has been very handy to me in this part of my journey. And from there, went to do my clinical training in OBGYN. And just became fascinated with the systems problems in healthcare. And I felt like I have 4 sons, and I felt like, that stage of children when they just keep asking you why to a point of like great annoyance, right? I've done 5 cycles of why, will you just stop, right? And that was a little bit me of like, why don't we have a protocol for this? Why hasn't anyone realized this isn't good for patient care? Why doesn't the patient, blah, blah, blah. And spent a lot of time talking to other clinicians of, doesn't this just drive you nuts, right? The inefficiency of this, the experience of this. And, clinicians are so mission driven, nurses, doctors, all of them, right? So committed to patient care that they're willing to put up with a lot just to fulfill that mission of taking care of their patients. So maybe I wasn't as patient, I don't know. But I felt like, maybe the way I can make my impact on patient care, which I did love, is sort of cutting across patients and improving these processes for clinicians who are working on the front lines. I went back to venture for a bit, thinking I would bring my expertise to that market and help make better investment decisions and create better technologies. And realized that one of the problems was that we didn't have the voice of clinicians in the creation of technology, or patients for that matter, right? There were too many technologies being created solely from sort of the business aspect, which is really the story of the electronic medical records. Most of them were created as transactional databases to capture billable events. They weren't created to enable better healthcare delivery. Yet they were sort of deployed to enable better healthcare delivery. So I decided that, I should sort of jump in with both feet and go, start a company and see what kind of impact I could make. So that's a long, meandering journey in some aspects. But what was important to me was, to wake up every day and work on something that I felt like was a problem bigger than myself, where I could have an impact as a change agent on that, and something that my skills lent themselves to. And I think being a physics major sort of started that, of being very analytical, the joy of solving difficult problems. And I do think that that diversity of experiences has served me very well, because in much of my job today, I'm sort of a translator between, the clinicians who we work with, my development team who builds software, the, investor and business community who want to know the impact of technology on the business of healthcare. And I can speak all of those languages.
So that notion of universal translator sounds like it's important. The communication aspect, the ability to work in teams, seems like it would be important. The ability to influence decision making, to be persuasive, if you will, given all of those things. So as you reflect back on your Middlebury experience, are there any things that, knowing what you know now, you would say to students, make sure you take advantage of these things? What would these things be?
So you just hit on a big one, the ability to communicate effectively. So make sure you take advantage of, your writing skills. It's, as I hire and build teams, it's difficult to find people with good writing skills. And I think Middlebury, requires some writing courses, but I think don't think of it, even if you're a scientist, as a requirement. Think of it as this asset that you're going to carry forward into your career, because it gets to everything. I mean, I have to write business plans, I have to write grant proposals, I have to write all sorts of things, and the ability to be persuasive and succinct and clear is so incredibly important. I know that there's, more of sort of a term around it, right? Around data literacy now than there was when I was in school. But, I look at this pandemic and I look at our politics of the past, however, 6 years. And I think one thing my largest takeaway is that there's a data literacy problem in the United States, and that the ability to consume complex data and draw conclusions from it, it's happening around the vaccinations right now, right, is really difficult. And we need people not only who have those capabilities, but who can teach those capabilities, who can simplify them and be persuasive within their communities. For others who, just don't understand data in the ways that they're expected to.
And what advice would you have for women interested in careers in science?
So, I again, sort of didn't map out this is where my career was going to go. And sometimes as I've thought through those different aspects, I was often the only woman in many of these jobs that I had. And that can feel intimidating, or you can say, everyone's going to remember my name, right? And, the same when I go to large conferences, it's easier for me to say, I'm the woman with long brown hair than I'm the guy in a blue sports coat. So, I say that sort of half jokingly, but I think about what advantages it brings you, not what disadvantages it brings you if you end up being a sort of minority in a community in which you're pursuing your career. I think there's a lot more appreciation today for diversity of experience and opinion. I do believe we as women sort of are, over-index in empathy, and I think that's incredibly important. I talk about empathy with my product development team all the time, because building software is easy, right? Building software that's really intuitive and impactful to the end users takes some degree of empathy, of understanding what that person's trying to do and what their situation is. So, sort of own your skills, own your uniqueness. And, I don't think it's any more complicated than that.
We've been speaking with Lucie Ide, founder and CEO of Rimidi. Thank you so much for your career field perspectives.
Thanks for having me.